Hello everyone, and I hope everybody is doing perfectly fine. So today, actually 2 days back, when I was reporting a case of from a hysterectomy specimen, I really found a very interesting case based on morphology, that is histomorphology. So this case is basically to highlight the histomorphology, what we see when we examine various sections from different region of uterus, cervix, ovary, and fallopian tubes. So this entity, this is Schwannoma like Leiomyoma. So I'll discuss in detail the clinical history, the gross picture, the gross specimen, the findings, the microscopic findings, and how we arrived at the diagnosis with the help of immunohistochemistry. So this what I was doing yesterday. So I just got time. So sometimes what happen when we get so much into work or becomes like we don't have time, the brain like it looks like fatigue. So what you can do sometimes to exercise your brain, so just you can have this. What I did is with this take the newspaper, open the page. This is my favorite page in Times of India. And what I do is sometimes initial days I used to do, but now I have started this habit again. So you should develop on whenever it's like, we forget our good hobbies, which good things which we used to do. So sometimes you can take out time apart from our busy schedule, we can have it. So this was the funniest or good thing which I did yesterday and which made me really happy also. So coming back to the case, this is a case of a 45-year-old female who complained of dysfunctional uterine bleeding for last 2 years. And on ultrasound, she was found to have a large intrauterine fibroid. And following which the patient was subjected to complete hysterectomy. So the type of specimen which we received was uterus with cervix and attached bilateral index. So gross, we received hysterectomy specimen with bilateral adnexa and it measured approximately 16 into 14 into 10. External surface appears enlarged, vacillated and was asymmetrical obviously. Cervix measured 5 centimeter in length. It showed tiny Nebrothian cyst. There was evidence of epidermidization. Then right ovary measured 4.5 into 2.5 into 2. Left ovary measured 2 into 1.5 into 1. The right and left fallopian tube measured 8 centimeter, 7 centimeter in length respectively. And when we cut the section, what we got, endometrial cavity was identified, endometrium measured 0.8 and myometrium measured 6 centimeter at its thickest. And also what we noted was on gross, a large intramural gray-white round to oval mass. This is the endometrial cavity, this cavity one, correct? And this is the portion of your cervix. This is our uterus and this is the endometrium and this area is the surrounding part is your myometrium surrounding the endometrial cavity. So this myometrium is showing a gray white round to oval mass and the cut section is showing world area and somewhere we can see it has some homogeneity also shining shiny surface like it has. So we give sections from here, we give sections from endometrium, endomyo sections we can give from here, and the cervix section we give from the cervical, ectocervix and endocervix. So this was the intramural grey white mass which I showed you. And cut section of bilateral tube, it showed patent lumen, and left and right ovary showed grey brown ovarian parenchyma and blackish discoloration. So that was not significant. So then what we saw in microscopy, when you write hysterectomy specimen report, how we write it, first we need to describe endometrium. The endometrial glands were atrophic in our case. So it was atrophic endometrium. Then when the section from the myometrium, the large grey round to oval mass which I showed you, so that was a large intramural growth that from that when we took the section, what we got was a benign tumor which was composed of extensive areas of spindle to wavy shaped cells and elongated wavy nuclei and had palisading arrangement. So these words are very important. And at the periphery of these wavy cells, we also notice interlacing pattern of spindle to oval shaped cells with elongated nuclei and vesicular chromatin. And we also noted some cystic degeneration with luminal macrophages. However, when we intensively examined the section, we did not find any increase in mitosis or any atypical cells in the sections examined. So this is seen. So when you see the picture, what comes to mind first? That this is a benign peripheral nerve sheath tumor, that is schwannoma. But wait, is schwannoma so common in uterus? The answer is no. So WHO in 2020, it has included that on morphology. Your leiomyoma can have wavy or palisading arrangement just like schwannoma. So here we can see there is extensive palisading arrangement here. So you can see hypocellular, then hyper. The spindle cells are arranged in palisading arrangement, it is there. So classic presentation of Schwannoma. And here we are seeing a wavy pattern of nuclei, so which is usually seen in neural tumors. And as I said, some cystic degeneration was there with the luminal macrophages. But now we need to know IHC. So leiomyoma is a smooth muscle tumor, correct? And what the morphology we are getting is a neural morphology. So that is Schwannoma when we are considering it. So we need to take help of IHC because in our section, multiple sections were given in our sample specimen, and in 60 to 70 to 80% region we saw this neural or the wavy pattern of palisading arrangements of the cells. So we were in a doubt that this is Schwannoma like leiomyoma or per se pure Schwannoma. So that for that you need to establish the origin of the tumor. So it is neural or it is smooth muscle. So basic, if we need to apply to IHC, we can apply here. Desmin we applied for to prove the origin of smooth muscle lesion, and S100 we applied to confirm if it was neural or not. So our case, Desmin was strongly positive. So that confirmed that this case is leiomyoma only, but the morphology is Schwannoma. So that is rare presentation. Had it remained SNL positive, so it would have been much rarer also, more rare, correct? So here what we are seeing, so it's the neural pattern ka dekho aap. Is all the wavy patterns are there, and it is very strongly positive for Desmin. So this is the high power I'm showing you. This is Desmin and this is S100. S100 is negative. Desmin has taken up very strongly positive in the area which we doubted for Schwannoma. So it is Schwannoma like leiomyoma. Cervix. Now this was confirmed for biometrical findings. So जब आप hysterectomy examine करते हैं तो हमें section cervix से भी देने हैं और जो attached bilateral adnexa है उससे भी हमने दिए sections. तो cervix it showed evidence of squamous metaplasia, Nabothian cysts, mild to moderate chronic cervicitis, and also one important finding was there. The subepithelium of cervix showed interlacing fascicle of smooth muscle with elongated nuclei, vesicular chromatin surrounding the endocervical gland. I'll show you the image. So these are the endocervical glands and इसके around same leiomyoma के pattern वाला intersecting fascicle of smooth muscle cells होती है जो normal leiomyoma में भी दिखती है. Then sections from right and left ovary showed ovarian parenchyma with dilated, thickened blood vessels. An extensive xanthogrammatous change was noted in bilateral ovaries. So here we can see xanthogrammatous change in entire ovary in both right and left. So this xanthogrammatous oophoritis. Simple cysts were also noted. So this was a complete diagnosis: atrophic endometrium, chronic cervicitis, with you have your cervical leiomyoma. And the main important rare diagnosis was our Schwannoma-like uterine leiomyoma and bilateral xanthogrammatous oophoritis. So, take home messages: leiomyoma is a very common tumor of mesenchymal tumor of uterus. So typical feature how we see leiomyoma described is very easy: intersecting fascicles of smooth muscles, bland shaped smooth muscle cells. However, nuclear palisading of spindle cells and verrucability. So these are the characteristic feature of your schwannoma. So uterine leiomyoma with predominant nuclear palisading is rarely seen, which was seen in our case. Until now, when I did the extensive literature search, only 4 cases have been reported. So association of when we see Schwannoma like leiomyoma, so it has association with hereditary leiomyomatosis and renal cell carcinoma. So those patients should be subjected to thorough examination. So as I said you, 2020 WHO classification, it is described that the nuclear palisading may be included in histological feature of uterine leiomyoma. So leiomyoma with extensive nuclear palisading in verrucate body appears to be rare. And for that, we need to confirm the origin of the tumor, that whether it is smooth muscle tumor, has a differentiation of smooth muscle origin or neurogenic origin. So for that, we need INC, Desmin for proving it as smooth muscle, and S100 to prove it has a neural. So in our case, it is Desmin positive. So it is Schwannoma like leiomyoma. So ours is fourth reported case in literature. So that is very rare finding for us. So thank you so much for your patient hearing. So kindly like, subscribe and share my YouTube channel Patho with MK. Thank you for your patient hearing. Have a good day.